Hello, my name is Lydia Andreevna Tarasova, and today we start bacteriology. And the first lecture will be about acute bacterial intestinal infection. Добрый день, меня зовут Лидия Андреевна Тарасова. Мы начинаем курс лекций по частной бактериологии, и первая лекция посвящена острым бактериальным кишечным инфекциям. Intestinal infections are a big group of diseases that combine a single route of transmission of the pathogen of the disease as well as its localization in body intestine. So intestinal infection, it's a group of infection which can make a disease in intestinal tract. It's clear. And the main mechanism of transmission that infection is fecal oral transmission. Ways of transmission can be different. The most often it's with food. Intestinal infection can transmit with food by alimentary way, with water, and by direct or indirect contact. Portals of entry of the infection is intestine. There are a lot of causative agents, some viruses such as rotavirus, enterovirus, adenovirus, fungi like candida, and bacteria, of course. The most common pathogen of bacterial intestinal infection are from Enterobacteriaceae family. Let's study types of interaction between bacteria and intestinal epithelial cells, because it's a way to understand the pathogenesis of bacterial intestinal disease. It's what happens in intestine, which what can happen in intestine when bacteria enter to human body. So there are four main types of interaction. The first is enterotoxic, colonization of the small intestine without disruption, typical for cholera, Vibrio, and Escherichia and enterotoxigenic Escherichia coli. In pathogenesis of enterotoxic infection, the main role is the main role in pathogenesis plays toxin. So bacteria does not multiply a lot, does not make some disruption, but it produces a lot of enterotoxin, which break down important process in intestine. Second type is temporary invasive cytotoxic and enterotoxic multiplication of on the surface of epithelium of small and large intestine with disruption of microvilli and apical part of enterocytes. And this type is more common for enteropathogenic Escherichia coli, EPEC, and how you can understand in pathogenesis of this type, main role plays multiplication and destroying of microvilli and um, and and pathogenic process on the surface of epithelium. Third type, highly invasive and cytotoxic. Uh, invasion and multiplication inside the epithelium of large intestine, leading to disruption and death of the cell and formation of ulcers and large intestine. And this type is more common for Shigella and intra-invasive Escherichia coli, AEIEC. Uh, so, in the pathogenesis of third type, the main role is for invasive process because this bacteria can invade can enter to the cell, can destroy the cell, can cause cell death, and they kill cells. That's why intestinal ulcers formate um, and some other process. And the last one is invasive without disruption of epithelial cell. Penetration inside M cell of the small intestine lymphoid cell in pairs patches and subsequent multiplication inside macrophage with possible dissemination in host, and this way is common for Salmonella and Yersinia. And so the last way, the first way is have some similar some similarity with thought, but in this way, bacteria they not they doesn't stay in intestine. They can disseminate. They can go to the macrophage, to the lymphoid cell, and they can disseminate in whole organism. So they can uh, uh, go to the blood, they can go to another organs and tissue. So uh, the high invasive possibility, it is the uh, main part of this process. So four type of interaction. First, to produce an enterotoxin. Second, to multiply, to destroy the surface and to destroy the microvilli. Third, to invasion to the cell, destroying the cell of intestine, cell death and ulcer, causing the ulcer. And fourth, it's a high invasive possibility. Um, Dissemination process, disseminate into the blood and other organs. Next. How I said previously, the main bacterial causative agents are from Enterobacteriaceae family. That's why we need to give a characteristic for this family. So this is the largest family of clinically important bacteria. There are both causative agents of intestinal infection and bacteria from indigenous flora of humans. Pathogenic species from Enterobacteriaceae family are Escherichia coli, which cause diarrhea, pathogenic Escherichia coli. Salmonella, which cause TB, salmonellosis, and other. Shigella, which cause dysentery, and Yersinia, which cause Yersinios and some other infection. Opportunistic infection including septicemia, pneumonia, meningitis, and urinary tract infection, causative agent Citrobacter, Enterobacter, Escherichia, Acnea, and Morganella. Okay. Morphology of Enterobacteriaceae family. All members of Enterobacteriaceae family are gram-negative rows. So if you want to study in microscope Salmonella or Shigella or Escherichia, you will see only gram-negative rows, and they will be similar. You can differ by microscopic method, Salmonella and Shigella. They are not big, and the cell wall is gram-negative. So it consists of lipopolysaccharide. You know that lipopolysaccharide it's a part of cell wall which consists of endotoxin. Some bacteria from this family can have a capsule and flagella, but no one can formate spore. And this is the cell wall of gram-negative bacteria. I hope you remember from general microbiology that that gram-negative cell wall is consists of peptidoglycan, 2 layers of peptidoglycan, and also it consists of inner membrane, which is made from some lipopolysaccharide, and the lipopolysaccharide has a three part. It's a O antigen, O polysaccharide. It's outside, sorry, and polysaccharide core, and very important part, lipid A. Lipid A, it's an endotoxin. It can cause high temperature because endotoxin is a pyrogen. Also, it can cause it can influence on blood pressure, and it can um, and it can cause lower blood pressure. And also lipid A influence on the vessels, on the small vessels, and all gram-negative bacteria, all Enterobacteriaceae members, they have lipid A and endotoxin. Antigens. The epidemiology serology classification of Enterobacteriaceae is based on three major groups of antigen. So somatic O polysaccharides, which is a part of lipopolysaccharide, which is present in the cell wall. K antigen in the capsule, only for members which can have capsule, and H proteins in the bacterial flagella, only for bacteria who has flagella. Strain-specific antigen are present in each genus and species. Virulence factors. capsule, which can make safety for bacteria, which can destroy the phag, process of phagocytosis, stop process of phagocytosis, and flagella for moving, invasion factor for invasion, uh, LPS toxin, and some bacteria from Enterobacteriaceae can uh, produce protein exotoxin. Biochemical feature, all members fermentate glucose. Some members can fermentate lactose, and some members are lactose negative. It's a very important feature because in the process of bacteriological diagnosis, we can differentiate Salmonella.Shigella, Yersinia if they not if because they not produce because they not fermentate lactose, and this is differentiation feature for this bacteria. Reduce nitrates to nitrates and oxidase negative and catalyze positive. Isolation. Isolation can be we can isolate Enterobacteriaceae from fecal matter on agar containing lactose and pH indicator. Colonies that ferment lactose will produce sufficient acid to cause a color shift in the indicator. Escherichia coli is a fermenter of lactose, while Shigella, Salmonella, and Yersinia are not ferments. Non-pathogenic strains of E. coli and other lactose-positive enterics are often present in normal pretzels. Since they are difficult to differentiate from pathogenic E. coli. Lactose negative colonies are often the only ones defined in pretzels. This is endometrium, which can be applied in the process of isolation, in the process of cultivation of Enterobacteriaceae, and lactose negative bacteria. They can grow on the endometrium without any color. But if if bacteria fermentate lactose, they formate colonies with color, and by this feature we can differentiate lactose negative and lactose positive. And as I said previously, most lactose positive Enterobacteriaceae members are not pathogenic, but lactose negative Enterobacteriaceae members, they can be pathogenic because it can be Salmonella, Shigella, or Yersinia. And also for cultivation Enterobacteria, we can apply Kliegler iron agar. Kliegler iron agar is used for differentiation of the Enterobacteriaceae members on the basis of their ability to ferment glucose and lactose and to liberate sulfides. Gas formed by carbohydrates ferments, it's detected as bubbles or by splitting or displacement of the agar. Hydrogen sulfide production is evidenced by a black color, is throughout the bud or in a ring formation near the top of the bud. So by the changing of the color of this media, we can find some features, some biochemical features like glucose and lactose fermentation, like hydrogen sulfide production, and like gas forming. So, The next part of our lecture is about Salmonella. Okay, Salmonella. Taxonomy of Salmonella. The taxonomic classification of the genus Salmonella is problematic. DNA homology studies have revealed that most clinically significant isolates belong to the species Salmonella enterica. Salmonella enterica has more than 2,500 unique serotypes. However, the serotypes are commonly listed as individual species like Salmonella typhi, Salmonella cholera suis, Salmonella typhimurium, Salmonella enteritidis. These designations are encoded. For example, the correct nomenclature is Salmonella enterica serovar typhi. Um, so, family Enterobacteriaceae, genus Salmonella, and one species Salmonella enterica. But these species divide into few subspecies. Salmonella enterica typhi, Salmonella enterica para typhi A, Salmonella enterica para typhi B, Salmonella enterica enteritidis, Salmonella enterica typhimurium. The main taxonomic group of Salmonella are family, genus, species, subspecies, and serovar. And it is necessary for diagnosis and in the epidemic analysis. Morphology, as uh, as all Enterobacteriaceae, Salmonella is gram-negative rod. Most serotypes are motile with Pyrrhichus flagella. Salmonella can move very quickly. For example, if you have some chicken eggs in your refrigerator in the higher shelf of refrigerator, Salmonella can move from the higher shelf to the lower shelf through one night. So it's this process of moving from the higher shelf to the lower shelf of your refrigeration take one night, about 6-7 hours. Salmonella non-capsulated and non-sporing. Most strains of most serotypes produce type 1 fimbria. History: typhoid bacillus was observed by Ebert in mesenteric node and spleen of fetal cases of typhoid fever and was isolated by Gebke. It came to be known as the Ebert-Gebke bacillus of Ebertella typhi. In 1885, Salmon and Smith described the bacillus and the designate as a Salmonella typhi. Resistant, Salmonella are killed at 55 degrees in 1 hour, at 60 degrees in 15 minutes. Boiling, chlorination of water, pasteurization of milk destroy the salmonella. They can survive for weeks in polluted water and soils and for months in ice. Cultures may be viable for years if prevented from drying. They are killed with 5 minutes by mercury chloride or phenol. So to kill salmonella, we need to use in cooking high temperature and and some chlorine for disinfection. Diseases. Enteric fever group consists diseases which caused by salmonella can be divided on two group. Enteric fever group consisting of typhoid and paratyphoid bacilli. These are exclusively human parasites. And food poisoning group more which we meet more often food poisoning diseases in our life. These are essentially parasites, animal parasites, but can also infect human being, producing gastroenteritis, septicemia, and localized infection. Antigenic structure, flagella antigen H, somatic antigen O, and surface antigen V, found in some species. Salmonella antigen structure based on the presence of O antigen. The Salmonella have been assignated to serogroups. The O group is designated by capital Roman letters A, B, C, D. So by O antigen, all Salmonella divided to the four groups A, B, C, D. And each Salmonella serogroup can be identified by the slight agglutination test. The H antigen are designated by small Roman letters and are kept in brackets and by Arabic numerals for phase 2. The use of specific H antisera helps to identify Salmonella serovars. So by O antigen, Salmonella can be identified to for serogroup, and by H flagella antigen, Salmonella divided to the sero variants or serotypes. Cultural characteristics. Salmonella are aerobic and facultative anaerobes, growing radially on simple media over a range of pH 6 and 8 and temperature optimum 37 degrees. Colonies are large, circular. Colonies morphology of Salmonella depends on the medias, on the in nutrient, agar, and blood media. Colonies most strains of Salmonella are moderately large, gray, moist, circular, with smooth, convex surface and entire edge. In peptone water and nutrient browse, we can see abundant growth with uniform turbidity of their surface. Pellicle usually forms on prolonged incubation, but more often to cultivate Salmonella we use McConkey bile salt lactose agar, and on this agar Salmonella form pale yellow or nearly colorless colonies. So this is blood agar, and we can say gray smooth colonies, and this is McConkey, and on McConkey agar Salmonella form colorless yellow colonies. And also Wilson and Blur's brilliant green bismuth sulfate agar, BBPA, can be applied in cultivation of Salmonella. This agar is especially for Salmonella typhi. Here the crowd colony is about 1 millimeters in diameter, make take up the dye from the medium and appear green or pale brown. All Salmonella may produce hydrogen sulfide, which cause the colonies to the surrounded by a metallic sheet. So you can see dark colony, and they dark because of production hydrogen sulfide. Biochemical test for Salmonella. ONPG test for B galactosidase is negative. Typically glucose, mannitol, arabinose, maltose, dulcitol, and sorbitol are fermented by not lactose, sucrose, salicin, or adenoidol. Indole negative, BP negative, citrate utilized, and malonate not utilized, gluconate not utilized, urease negative, hydrogenic sulfide produced in ferrous chloride gelatin medium except by Salmonella paratifi. So this is the main biochemical tests for Salmonella. When in the stage of identification, in the process of bacteriological method, you when the in the process of bacteriological uh, method, we can get a pure culture of Salmonella from feces of patient, and to identify Salmonella, we can use this biochemical test. Test for glucose, mannitol, arabinose, maltose, test for indole, for hydrogenic sulfide, the main. Okay, factors uh, factors of virulence of Salmonella. Factors of adhesion and colonization. Adhesion and colonization is by pili, by fimbrium. Ability to intracellular parasitism to prevent phagocytosis to multiply in cell of lymphoid tissue are expressed in pathogens of typhoid fever, paratyphoid A and B, contributing to chronic care. Endotoxin, LPS, thermolabile and thermostable enterotoxin, cytotoxin, plasmid of viral plants and air plasmid, antibiotic resistant plasmid. V antigen inhibits the action of serum and phagocytic bactericidal factors. Okay, factors of virulence. Fimbria for adherence. Also uh, also flagellum to motility to invade to enter to disseminate in organism, or antigen inhibit phagocyte killing. V antigen inhibits complement binding. Antiphagocytic proteins induced by oxy-air, endotoxin in LPS, enterotoxin causes diarrhea, and cytotoxin inhibits host cell protein synthesis, calcium influx into host adherence. Pathogenesis. After ingestion and passage through the stomach, Salmonella attach to the mucosa of the small intestine and invade into the M microfold cell located in pair patches as well as into enterocytes. So it is a main part of pathogenesis when bacteria enter to the stomach and then it goes to the lymphoid tissue, to the pair pages. V polysaccharide limits phagocytosis. So phagocyte can do its work. Phagocyte can't kill bacteria. Macrophage oxidative growth inhibited. Macrophage must digest bacteria, must kill, must destroy, but it can because of V polysaccharide. The bacteria remain in endocytic vacuoles where they replicate. So bacteria replicate multiplied inside the macrophage. Difference between TIFI and other serotypes of the prolonged intracellular survival in macrophage. So, in the case of TIFI, Salmonella can live in the macrophage through a long time. Next step, bacteria are carried through the lymphatic circulation to the mesenteric nodules, spleen, liver, bone marrows. Infection spread to the reticular endothelial system. Increasing of bacteria population begins to overflow to the bloodstream. And this is the main part of pathogenesis, because when bacteria goes to the bloodstream, patient feel high fever, intoxication, and it, uh, its condition is very bad. The entron, because the entry of gram-negative bacteria, their helpers and the toxin into the blood starts fever, because you know that all gram-negative bacteria um, they have LPS in the toxin. And when bacteria goes to the bloodstream, uh, blood destroy bacteria, because blood has antibacterial components. And bacteria and gram-negative bacteria, a lot of gram-negative bacteria destroyed in the blood. And a lot of lipopolysaccharide, which were in the cell wall of this bacteria, uh, became free, and lipopolysaccharide lipid A uh, uh, goes to the blood, and lipid A is an endotoxin, and endotoxin causes fever. 40 degrees. So this is a pathogen. Pathogenesis bacteria enters to the stomach, and then it, because of its higher invasive possibility, fourth type of interaction, it goes to the M cell macrophage, and start to multiply inside the macrophage cell, because it blockade and inhibit the phagocytosis, and goes to the lymphoid nodules, lymphoid tissue, multiply a lot in lymphoid tissue, and then from lymphoid tissue goes to the blood and disseminate through the whole organism. The ingested salmonella reach the small intestine, from which they enter to the lymphatic space and then the bloodstream. After an incubation period, 10 or 14 days, fever, malaise, and headache acute due to bacteremia and toxicity of salmonella products. The skin may become dotted with small hemorrhages called roseoles. Uh, roseoles formed because of presence bacteria in the blood vessels, microvessels. Gastrointestinal symptoms appear late and course of disease. Blood culture are positive only in the first week of disease. At the beginning of the second week, microbes are carried by the blood to many organs, including the liver, kidney, and intestine. Salmonella multiply in intestinal lymphoid tissue, kidney, and are excreted in stools and urine. The stools and urine cultures give positive result on the second and third week. It's a important moments in diagnosis. So first week of disease, you can get blood from patient and send it to bacteriological laboratory to find salmonella. But if your patient is on the second and third week, the blood will be negative. will be bacteriological negative, but you can get stool, fetum, urine, and send it to bacteriological laboratory to find salmonella in this material. Okay, the stage, third stage, the invasion, the second stage, the invasion, third stage, bacteremia, and bacteremia, uh, when the features of disease will appear when high temperature will appear when patients will send for the doctor. And on this stage, blood will be positive in bacteriological method. Only on this stage you can get bacteria from the patient's blood. And then fourth stage, bacterial dissemination, hyperergia and excretion, and final stage. Immunity acquired is relatively stable, but relapse and reinfection sometimes occur. And also, Salmonella can survive in liver and in uh, some patients can become the carrier. Gastroenteritis pathogenesis. Okay, uh, we just studied typhoid pathogenesis, but also we said that Salmonella can cause gastroenteritis, and Salmonella's gastroenteritis uh, can occur more often than typhoid. Exactly, we don't meet typhoid fever so often, but gastroenteritis, it's very not so rare. Every holidays, every New Year's, we have a higher, we have a lot of cases of Salmonella gastroenteritis, and if uh, if in the case of Salmonella typhoid fever, uh, the main source of infection is human. So typhoid fever is a anthroponosis, only transmission only for people to people, human to human. But in the case of gastroenteritis, the source of infection can be animals, chicken, pig, and the way of transmission more often is by food elementary. When somebody eat some chicken eggs, so pig meats and other. And pathogenesis have some difference. So, Salmonella enterica swims through intestinal mucous layer. Pili initiate adherence. Salmonella enterica injection induce the creation membranes rafus. Rafus induce endocytosis. Intracellular survival of pathogen, invasion, and inflammation cause diarrhea. But spreading in the bloodstream is rare. In the case of typhoid fever, spreading in bloodstream is a main part of pathogenesis. It's a obligatory part of pathogenesis, but gastroenteritis more often stop in this site. Invasion, inflammation, diarrhea. In difficult cases, bacteria can spread in bloodstream, and in this case, we will have a clinical picture as a typhoid fever. Salmonella rufus destroying macrophage. Diagnosis: culture salmonella in blood or feces is primary diagnostic method, detecting antibody to salmonella antigen by ELISA. So For diagnosis, in the case of Salmonella gastroenteritis, you should take fedsum, stools, and send it for bacteriological method or also for PCR. In the case of typhoid fever, you should take blood if uh, if it's the third week of disease and you can see the features of sepsis, or fecal stools and urine if your patient on third or second or third weeks of disease. Also for bacteriological method and PCR. And also, after 8 days of disease, you can take serum for ELISA to find antibody against salmonella. Blood, okay, blood cultures are positive only on the first week of typhoid fever. At the beginning of the second week, microbes are carried by blood to many organs, including the liver, kidney, and intestine. Salmonella multiply in intestinal lymphoid tissue, gallbladder, kidney, and are excreted in stools and urine. The stools and urine culture yield positive result on the second and third week. A positive culture of bile establishes the presence of Salmonella genus in the biliary tract of carriers. So to find carriers, we need to check its biliary, and we need to check its fedsum. Okay, this is this is a lab diagnosis. Mhm. Salmonella infection treatment is with antimicrobial therapy. Replacement of fluids and electrolytes are essential. Susceptibility testing is an important method to choosing a proper antibiotic because multiple drug resistance is a big problem in enteric bacteria. Prevention killed whole bacterial vaccine, live attenuated tissue vaccine, polysaccharide vaccine contain antigen. And this way of vaccination is only for typhoid fever and only in endemic diseases. So Russian vaccination not consist TIF vaccine. It is not obligatory, just for uh, epidemic reason. Okay. Okay. Next pathogen is Shigella. Mhm. Okay. Mhm. Shigella is a causative infection agent of dysentery. Dysentery is a clinical condition of multiple etiology, characterized by frequent passage of blood-stained mucopurulent stool. So, main feature of dysentery is the presence of blood in the stool. The causative agent of bacillary dysentery belongs to the genus Shigella. Shigella is named after Shiga, who in 1896 isolated the first member of the genus from epidemic dysentery in Japan. Other bacilli, such as enteroinvasive E. coli, Vibrio parahemolyticus campylobacter can also cause the clinical feature of dysentery. And also we know dysentery which cause protozoan as a um, enter-amoeba who cause protozoan dysentery. But now we discuss Shigella's dysentery. Taxonomy. Shigella is belong to family Enterobacteriaceae, genus Shigella, and there are few species: Shigella dysenteria, Shigella flexneri, Shigella bowdii, Shigella zoni. Shigella also gram-negative rods, non-spore formated, but can have microcapsula and no motile without flagella. Facultative anaerobe but grows best aerobically. And it is lactose negative, that's why on lactose containing media it formate colorless colonies. All Shigella ferment glucose form acid, with the exception of Shigella zone, they don't ferment lactose. Glucose positive, lactose negative, mannitol positive, hydrogen sulfate negative. It has O somatic antigen and K surface capsule antigen. Antigen structure, Shigella are differentiated by their O antigen into serotypes: serogroup A, serogroup B, serogroup C, serogroup D, as it was in Salmonella. Shigella-induced infections are almost always limited to the gastrointestinal tract. Bloodstream invasion is quite rare. All Shigella produce endotoxin because it's a gram-negative bacteria. Micro abscess in the wall of the large intestine lead to necrosis of the mucous membrane, superficial ulceration, and bleeding. Shigella dysentery also produce a heat-labeled exotoxin that affects both the gut and the central nervous system. Pathogenesis. Infection occurs by ingestion, being capable of initiating the disease probably because they survive gastric acidity better than other enterobacteria. Shigella enter to the epithelial cell of the villi, is the large intestine and multiply inside them, spreading laterally to involve adjacent cell and penetrate to the lamina. It is the most important part of pathogenesis, penetration into the lamina. Inflammatory reaction develops with capillary thrombosis, resulting in necrosis of patches of epithelium, which slows off and leaves transverse superficial ulcers behind. Shigellosis has high death rates, especially in young children. Most deaths are caused by Shigella dysentery type 1. So Shigella goes to the large intestinal tract, adherence, and then invasion. Invasion through the M cell, invasion to the macrophage, invasion, and very important, it's an invasion to the epithelial cell. In Shigella can migrate through the disrupt tight junction. Multiplication and intracellular spreading. Intracellular spreading, it's a special Shigella possibility. It can go through the one cell to the other cell and kills the cell, destroys the cell, destroy because of indirect because of direct contact, because bacteria multiply inside the epithelial cell, and epithelial cell will destroy. And also by production some exotoxin which destroy the process of protein biosynthesis, and uh, so bacteria kill the cell by blocking the process of protein synthesis. So you can see on this slide how bacteria invite to the intestine, multiply in enterocyte, go through the uh, cells and destroy the cells, and also it can multiply in the macrophage, and also in the pathogenesis of shigellosis. Very important role plays shigatoxin. Shigatoxin, it's an exotoxin. So bacteria produce this toxin, and this toxin goes to the enterocytes and stop the process of protein synthesis, and that's why the cell will have a death. So this process of cell killing by broken the process of protein synthesis. Shigellosis is the infection with the fecal oral route of transmission. After a short incubation period, 1 or 2 days, there is a sudden onset of abdominal pain, fever, and watery diarrhea. A day or so later, as the infection involves the ileum and colon, the number of stools increase. They are less liquid, but often contain mucus, pus, and blood. Blood in the stool is because of cell killing, because cell enterocytes are destroying, and ulcerous formation, micro abscess formation, high inflammation process, and that's why uh, large intestine start bleeding, and we have and we can see blood in the stool. And blood in the stool, it's a main feature of dysentery. In children and other elderly, loss of water and electrolytes may lead to dehydration, acidosis, and even death. Infection is followed by a type-specific immune response, but reinfection may occur. Lab diagnosis, clinical specimen stools, rectal swabs, and method, bacteriological method is the main. Also, PCR, very important method, and then serological method to find the antibodies in patient serum, and skin test with this. But skin test, it's a old method, and I can say that now we don't use this test. It's an allergic test, and immune fluorescence and lattice agglutination rapid diagnosis. But also, we don't use this test. We use bacteriological diagnosis and PCR. Bacteriological examination, we applied a special media like McConkey, Ploskerev, and on this media, Shigella formate colorless lactose negative colonies, and in the process of bacteriological method, pure culture will be get, and identification by main biochemical features. Treatment: AB ciprofloxacin, ampicillin, tetracycline, chloramphenicol. The antibiotics may be effective in limit multiplication. There are no vaccine available for immune prophylaxis of bacterial dysentery. That's why isolation of patient and disinfection of excreta, detection of subclinical cases, sanitary control of water, food, and milk. So that's all. Thank you for attention. If you have any question, you can write me uh, for my email.